Hello and welcome to this lecture. Today we are going to discuss another topic, and the title of the topic is leprosy. So I'm presenting a case of a 39-year-old gentleman initially presented to a community health center in Malawi, uh, Lalangwe district, with widespread skin lesion on the face, torso, and tricep aspect of the right arm. He was referred to the neighboring district hospital with allergies. The lesions was long standing and had evolved relatively slowly. He was otherwise well, though concerned about the patches of an anesthetic skin on his face and on the sole of his feet. He denied any past medical history, although his blood pressure was incidentally raised at 150/93 mm of Hg. He smoked occasionally and drank moderate amount of alcohol. On examination, the gentleman has widespread skin nodules and scaly plaques with characteristic thick dermis on his cheek and feet. He had thick facial nodules and there was evidence of eyebrow loss, symptoms consistent with early Leone facie. This appearance and the description of the lesions, anesthesia, and peripheral neuropathy were highly suggestive for lepromatous disease. He also had slight discomfort in his right upper quadrant and mild right testicular tenderness and swelling. Due to limited resources, the only suitable laboratory investigation available were the blood count and urea and electrolytes. The only abnormality was mildly raised white cell count. The gentleman was assigned a clinical diagnosis of leprosy as defined by WHO, World Health Organization standard diagnostic criteria. These are the pictures that has been given in the case, and the article has been published in Infectious Disease of Poverty. You can read this article. So it is usually caused because of the causative agent M. leprae. It is also known as Hansen disease. So please do not confuse with the name. And it is usually occur in the skin and peripheral nerves, endemic to several tropical nations. The source of infection and the route of transmission is not known. However, it is usually caused because of the soil. And when this microorganism come inside to the body, then macrophages will take and they it spread through the blood, and then it will go to the peripheries, to different parts, and it usually stay at the cool tissues and in the extremities, in the peripheral areas. The temperature will be around 32 to 34 centigrade. And the microorganism, like the it affecting because of the presence of the cell wall and the viral cell wall, classified into tuberculoid and lepromatous leprosy. How we determine the type, it depends upon the immune response, especially the helper T cells, which is known as the part of adaptive immunity. This is a table to differentiate tuberculoid and lepromatous leprosy. Tuberculoid is actually is number of lesions is less as compared to lepromatous. The destruction in the tuberculosis will be very few as compared to the lepromatous. Then the transmission is low. So in overall, tuberculoid leprosy is not as severe as compared to the lepromatous leprosy, which have a number of lesions high. Tissue destruction will be high. There will be the presence of bacilli in the smears. Transmission is also high. But if we need to diagnose, how we need to diagnose, we need to do the lepromin test, lepromin skin test, which is positive for tuberculoid but negative for lepromatous leprosy. The cell-mediated reaction is present in the tuberculoid, where it is not present or reduced in lepromatous leprosy. So what happened? We see that these are the erythema nodosum will be formed, or vascularitis, inflammation in the vessels. And erythema nodosum is the, you can see that the red skin patches that can be seen. So when we see the morphological characteristics of tuberculosis leprosy, it is localized red skin lesions will be formed. They will be enlarged and irregular shape, indurated, elevated, and hyperpigmented margins will be found. Whereas the neuronal involvement is also dominant in the tuberculoid leprosy. Nerve degeneration causes skin anesthesia and skin and muscle atrophy, and person is liable for any trauma and leading to development of chronic skin ulcers. So this is a picture that how that skin patch will be formed. Whereas in lepromatous leprosy, it is more affected in the anterior eye of the chin, anterior eye chamber, peripheral nerves, upper respiratory airways, down to the larynx, testis, hand and feet. The vital organs and central nervous system are rarely affected. So it means that it is not affected the CNS, it is affected the peripheral nervous system. That's the main thing. And there will be formation of macular, papillar, or nodular lesions on the face, ear, wrist, elbow, and knees. Loss of sensation and trophic changes on the hand and feet follow the nerve lesions. So this is a picture of the microscopic characteristic way they forming the lepra cells. These round structures that can be seen here is the foam cells that will be produced in microscopic characteristics. So these round structures, these are known as the lepra cells that will be profound then. And then we mentioned that there is a collection of proliferating foam macrophages, lepra cells, that is the main characteristic. And then we have sparse lymphocytes. It means scattered lymphocytes. So the word sparse means scattered. And we have a clear subepidermal zone because the lymphocytes are scattered. This is a picture of tuberculoid leprosy. The main thing we found that a number of lymphocytes will be formed. In this case, that there will be a number of lymphocytes. I mentioned here many number of lymphocytes. Then we have sparse Langerhans giant cells, and we know that Langerhans giant cells, they are just make like a horseshoe structures where the macrophages will combine and they form the horseshoe structures. And so if you see the structures like this structure, they make a horseshoe shaped structure. So that's why the sparse Langerhans giant cell will be formed. And these are the main key characteristics that will be observing in this case. This is a picture how it look like. It can be identified using the acid fast bacilli. And you can see the red synapses, the red zones, that will be diagnose the disease within the macrophages. Clinical features in tuberculosis, there will be a distinct sensory impairment, whereas in lepromatous leprosy, the sensory disturbance is not as distinct. In tuberculosis leprosy, the skin lesions with few asymmetrical or hypopigmented or erythematous macules will be found, whereas in lepromatous they will be more symmetrical, multiple. There will be formation of slightly hypopigmented and erythematous macules, papules, and nodules, and diffuse infiltrate will be found. So thank you so much for today's lecture. Hope to see you again.